There is a short list of medication, although seemingly safe and innocuous, that can actually increase your risk of developing dementia substantially. I'm going to talk about this short list of medications in this video and give you some pictures of the brand names. These medications are both prescription medications and over-the-counter medications. Your doctor may have told you these medications are safe for the long-term treatment of your insomnia or difficulty getting to sleep, or you may be buying these medications over the counter with the false belief that just because something is over the counter that it must be safe, or that wouldn't be the case. That's absolutely not true in the case of this short list of medications. I'm Dr. Berry, I'm a family physician, and I want to help you avoid dementia by telling you about this short list of medications. These medications are all in a drug class known as anticholinergics, and they're prescribed for many different things, including insomnia, depression, mood disorders, neuropathic pain. But in this video, we're just going to talk about taking them for sleep. Many doctors will prescribe this class of medications for insomnia, even though they're not specifically FDA approved for that, because they do in fact make you sleepy. There are many things in life that can make you sleepy that are definitely not safe for long-term use, like a fifth of vodka, right? That'll make you sleepy and make you pass out, but that doesn't mean you're getting healthy, restful sleep. It doesn't mean it's healthy for your brain to do that every night for months and months or years and years. This medication class, the anticholinergics, have been linked in multiple research studies with an increased risk of dementia. So if you'd like to not have dementia and decrease your risk for developing it in the future, then please avoid these 6 medications for getting sleep. The first medication in this drug class is the over-the-counter one. So you would think, well, it's over-the-counter. It wouldn't be that way if it were dangerous. Absolutely not the case. It's called Diphenhydramine, and it's marketed under multiple brand names all across the world. In the United States, you can buy this as Benadryl, or you can buy it as ZQuil, or you can buy it as Unisom, and then there's hundreds of different generic brands of this, but it's Diphenhydramine, and if you take this every night to help you get to sleep, it's going to increase your risk of dementia. The next drug to avoid using every single night to help you get to sleep is Amitriptyline, and it's marketed under the brand name Elavil and several other brands and generics as well. It is in this drug class and will increase your risk of dementia with long-term use. The next drug in this class is Doxepin, which is marketed under the brand name Sinequan or Silenor, and it's actually marketed as an insomnia drug, but it absolutely increases your risk of dementia, and you should avoid nightly use of it. The next drug in this class is Hydroxyzine, and it's prescribed for multiple different uses, but many doctors will give it to you as a safe insomnia medication. It's marketed under the brand names Vistaril and Atarax and other names. It is an anticholinergic, and it will increase your risk of dementia with long-term use. The next drug in this class is Seroquel, which is marketed as Quiapine and several other names. It is an anticholinergic, and long-term use will increase your risk of dementia. Now, the research on this so far is that older people using this for insomnia, it definitely increases their risk of dementia, but we don't really have any research on people in their 20s, 30s, and 40s taking these medicines every night for insomnia. Why would we think that they won't increase your risk of dementia as well? The final drug I want to talk about is Trimipramine, which is marketed under the brand name Sermontal and several others. It is an anticholinergic. Taking it every night to help you get to sleep will increase your risk of dementia, in my opinion, regardless of what age you are. Now, a lot of people will give Diphenhydramine, which is Benadryl, to their children every night to help them get to sleep, believing that since it's over the counter that it must be very, very safe. I would be highly cautious of giving this to your child every single night for sleep, regardless of their age. I think that using these pills or liquids occasionally for rare insomnia is probably fine. It's the long-term nightly use that's going to really bump up your risk of developing premature dementia. My recommendation is that everyone over the age of 40 should avoid using these medications nightly, 100%. You should not do that. If you're currently taking one, go see your doctor, have a conversation and say, hey, I heard this increases my risk of dementia. Is this true? If so, then I want to switch to something else or wean down and stop this and try to just get sleep more naturally without taking a pill every night. Hopefully your doctor will be on board with that. Getting good sleep every night is very, very important, but you do not want to be taking an anticholinergic every night to try and get some sleep. You have to find an alternative. Hope this video helps. This is Dr. Barry. I'll see you next time.